And you can use a billion medicines for blood pressure and for cholesterol and so on and so on. And this is where the money starts to stack up. And then people say that they cannot afford their health care, when in fact, people who have these diseases are usually overweight, and if we just work with what's up here, this stuff will go away. Our diabetic patients who are overweight, type 2 diabetics who are overweight, as they lose weight over the next 4 to 6 to 8 weeks, almost all of them, I've removed all their diabetic medications, and their sugars are normal. Well, how can that be? Well, because we believe that obesity and diabetes type 2 are linked. Now, there are some levels of fringe thinking that say that diabetes produces obesity and not the other way around. But that's fringe thinking. I happen to like that particular concept, but right now, that's not what we're dealing with. The other thing I want to tell you is that thin people get all this stuff. All right? So, well, my Uncle Harry, Doc, you're wrong, because my Uncle Harry, he was thin and he got the diabetes. Well, I've got those patients too. But 80% of the patients who have diabetes are overweight. And as they lose weight, their diabetes goes away. If you're one of these people who qualifies for gastric bypass surgery and you get gastric bypass, your diabetes goes away. I haven't seen a single one. There may be some. I haven't seen a single patient with type 2 diabetes who gets gastric bypass and their diabetes doesn't go away. So, these are some of the things that happen. But instead of dealing down here, I like to live over here, because I consider this America. This, to me, is the land of opportunity. Okay? This is not the land of opportunity. This is the end stage. This is what happens after many years of not dealing with this. And this sometimes even begins in childhood. So let's talk about some of these ingredients. What are they? Our genes. Heredity. Can't change them, but your genes are not your destiny. Okay? So if our whole family's fat, you can still lose some weight. A lot of weight in most cases. Binge eating disorder. The most common eating disorder in this country. We don't talk about it. We talk about anorexia. We talk about bulimia. Diseases that make people very thin. Well, how many bulimics and anorexics have you seen on the street today? Probably none. I have a trained eye. I'm constantly looking for people that I can think in the back of my mind as I sit at the coffee shop and say, I'll bet they're bulimic. I'll bet they're anorexic. I can't find them. Occasionally I see one. But generally, what I see is a lot of fat people at the Starbucks having their double mocha cocoa waka waka lattes with 1 billion calories. All right. So, binge eating disorder, very common. Binge eating disorder is defined by the American Psychiatric Association's Diagnostic and Statistical Manual by 2 critical questions. 1, do you eat a lot and feel that you can't control yourself when you sit down to eat? And 2, when you do so, do you feel guilty or ashamed? Those are the 2 diagnostic questions. They're in our questionnaire for our intake patients. Disordered eating syndrome. This is not a real syndrome. This is what I call it. These are folks who eat once a day. Their idea of losing weight is they're going to eat once a day or they're going to skip breakfast, and it doesn't work. Some people just are very busy. They won't eat breakfast. They might even skip lunch. Eventually they have dinner and they go to bed. Not good for weight loss. The king of all killers, carbohydrate addiction. Folks who are eating a lot of carbs. These carbs bind receptors in the brain, and it stimulates them to eat even more. This is a very common thing. I live in Miami. Lots of people here love rice and beans. It's a Cuban dish that I grew up with, and it's carb city. But carbs come in all kinds of things. Sometimes they're even hidden, and we don't look for them. Obstructive sleep apnea. Many people who are overweight have breathing disorders when they are overweight. And we administer a questionnaire that gives us an idea, and then based on that, we might send them for a full sleep test. Medications are another set of things that go into this funnel. I am tired of seeing patients coming into this office with medicines that are prescribed by other physicians that cause obesity. Oh, by the way, sometimes they're prescribed for diabetes. And so the very thing that makes them diabetic, in many cases, the doctor is giving medicine for diabetes that causes obesity. So sometimes I get upset at my colleagues. Sometimes there are psychiatric medications for depression or other things that cause obesity, And if we need those and we can't get away from them, we have to use them, and that's all there is to it. But very often we see that there are variations to those things that we can do. And they don't have to use those particular medicines for psychiatric illnesses. We can choose others. And I help the psychiatrists go through this sometimes. Medication, sleep apnea, stress and anxiety. Boy, have you ever heard of this stuff? It's all around. So some people are eating out of stress and anxiety. Some people have what I call premenstrual eating syndrome. That's not a real medical diagnosis, just what I call it. But before their periods, their appetites start to go up. And so when we try to figure out why you're overweight and why you have these illnesses, we have to look up here. There are many others to this list. By the way, this is not just a limited list, it's just for the illustration of this particular lecture. In our office, when we do intakes, we go through many other things that are not this.